Acceleration of labor, the speeding up of labor by the use of drugs, usually via a syntocinin drip. Active labor, also known as the first stage of labor. This is the period after the latent, early stage of labor when a woman is experiencing strong, regular contractions and her cervix continues to dilate from 4 cms until she is fully dilated, 10 cms. Albumin, this is a protein. If it's present in your urine, it may be a sign of preeclampsia or of an infection such as cystitis. Alpha-fetoprotein, AFP, a substance present in the blood of pregnant women. This is tested as part of the Down syndrome screening tests. You may need further tests if your levels appear higher or lower than normal. Amenorrhea, absence of menstruation. Amnionitis, inflammation of the inner layer of the fetal membrane. Amniotic fluid, AF, sometimes called liquor, liquor, this is the fluid that surrounds the baby in the uterus, womb. Amniotic sac, the bag in which the fetus and amniotic fluid are contained during pregnancy. Antenatal care. Antenatal care is the care given to a woman during her pregnancy. Antenatal, before the birth. Antepartum hemorrhage, APH, bleeding, before the birth. APGAR score. An APGAR is a quick test performed at 1 minute and 5 minutes after birth. The 1-minute score determines how well the baby tolerated the birthing process. The 5-minute score assesses how well the newborn is adapting to their new environment. The rating is based on a total score of 1 to 10, with 10 suggesting the healthiest infant. Artificial rupture of membranes, AROM, if the neck of your womb, the cervix, is slightly open waters where they bulge down in front of your baby's head. Breaking the waters in this way may stimulate the onset of strong labor. Assisted delivery, the use forceps or vento use to speed up the delivery, or to move the baby if they have become stuck. Ballottement, technique of palpation used to detect floating object in the body. The sensation of an object rebounding after being pushed by an examining hand. Bartholin's glands, small, mucus-secreting glands located at either side of the base of the vagina. Blood pressure, BP. It's important to have your blood pressure measured, as a rise could mean a problem. Braxton Hicks contractions, painless intermittent contraction of the uterus during pregnancy. Breech presentation, this means your baby is lying bottom or feet down in the uterus. Caesarean section, C/S, delivery of an infant through an incision in the abdominal and uterine walls. Caesarean section is an operative procedure in which the fetus is delivered through a surgical incision in the maternal abdominal wall and uterus. The primary goal of caesarean delivery is the preservation of the life and well-being of both mother and fetus. Cephalic, this means the baby is lying with its head in the lower part of the uterus. Chorionic villi sampling, CVS, a prenatal test that scans for genetic abnormalities. Congenital, present at birth. Crowning, the point in labor when the head of the baby can be seen at the vagina. Curettage, scraping of the inner surface of the uterus with a curette to remove its lining or contents. Delivery, expulsion of the fetus, placenta, and membranes at birth. Developmental age, DE, conceptional age or embryonic age is the number of weeks and days since fertilization. Because fertilization usually occurs about 14 days after the first day of the prior menstrual period, the GA is usually 2 weeks more than the DE. Diamorphine, this is an injection like pethidine, sometimes given for pain relief in labor. Like pethidine, it can cause drowsiness and nausea. Dilation/dilatation, in the first stage of labor, the cervix, or neck of the womb, gradually opens up to make space for the baby. It needs to open to approximately 10 centimeters before the baby's head can pass through. This process is called dilation of the cervix. Doppler, this is a small handheld machine that picks up your baby's heartbeat by ultrasound. Dyspareunia, painful intercourse. Eclampsia, a serious complication of pregnancy, characterized by high blood pressure and Edema, swelling, which in its worst form can result in a seizure, fit. It is the more severe form of preeclampsia. Ectopic pregnancy, a pregnancy that develops somewhere other than the uterus, usually in the fallopian tube. This pregnancy cannot be allowed to continue as it is dangerous. Effacement, thinning and shortening of the cervix that occurs just prior to dilatation. Engaged, this means that the widest part of the baby's head has passed into the pelvis in preparation for giving birth. Entonox, a mixture of oxygen and nitrous oxide, inhaled through a mask or mouthpiece by the mother during labor for pain relief. Also called gas and air or gas and oxygen. Epidural, an injection of local anesthetic into the lower back, given for pain relief during labor. This can be topped up via a catheter, a thin tube, that is left in place during labor. For most women, an epidural takes away all the pain of contractions. Episiotomy, a cut made in the mother's perineum, the area between the vagina and anus, to allow the baby to be born more quickly and prevent tearing. Expected date of delivery, EDD, the date when your baby is due. Sometimes called EDC. Expected date of confinement. External cephalic version. External version is turning the fetus from a breech to a cephalic. Presentation after 34 weeks and before 37 weeks of gestation. Face presentation, when the attitude of the head is extension and the face lies in the lower pole of the uterus. Fallopian tubes, part of the female reproductive system. The eggs produced in the ovaries have to travel down the fallopian tubes before embedding in the lining of the uterus. Occasionally a fertilized egg will embed in the tube, causing an ectopic pregnancy. Fetal blood sampling, FBS, this is a test that is sometimes needed on the baby during labor. If the baby's heart rate tracing shows a heart rate pattern that is worrying, the doctor may want to check that the baby is coping well with the labor to make sure it is safe to let the labor continue. It involves taking a tiny amount of blood from the baby's scalp using a speculum and can reduce unnecessary interventions during labor. Fetal distress, sometimes the strength of labor contractions can reduce the baby's oxygen supply, causing the baby to become distressed. This is usually indicated by a persistently abnormal heartbeat or an irregular rhythm. Fetal heart, FH, you may see FH heard or FHH on your notes, that means your baby's heartbeat has been heard. Fetal movement, FM, it may say FM felt or FMF on your notes, that means your baby had been felt to move. Fetoscope, a stethoscope used for listening to fetal heartbeat. Fetus, medical name for the baby, before it's born. First stage of labor, the time from the beginning of labor until the cervix is fully dilated to 10 centimeters. The first stage can vary from a few hours to 12 hours or more. Fontanelles, the two soft spots on a newborn's head where the skull bones do not yet meet. Forceps, a pair of hollow blades, rather like large salad servers, which are placed either side of the baby's head to assist with the birth. When this happens, it is known as a forceps delivery. Fundus, this is the top of the uterus. The fundal height helps assess the growth of the baby and how many weeks pregnant you are. It's the length in centimeters between the top of the uterus and the pubic bone. Gestation/gestational age, how far into the pregnancy you are, measured from the first day of your last menstrual period. Hemoglobin, HB, this is a substance in the blood that carries oxygen and it can be low if you have low iron levels, anemia. Hemorrhage, sudden and severe bleeding. In pregnancy, it is usually called antepartum hemorrhage and after the birth it is called postpartum hemorrhage. Any bleeding in pregnancy should be reported to a doctor or midwife. Spotting or slight bleeding is not unusual in early pregnancy and not usually an emergency. Sudden bleeding, especially if accompanied by signs of shock, pale skin, sweating, feeling faint and a weak pulse, all indicate a medical emergency. Call an ambulance and/or doctor straight away. Hyperemesis, excessive pregnancy-related nausea or vomiting. Hypertension, high blood pressure. Hypotension, low blood pressure. Hysterectomy, surgical removal of the uterus. Induction, starting the labor artificially.